Medical Dialogues, your daily dose of health and medical news. I am Dr. Rashi Prakash, and here is what I bring to you all from the world of medicines. New one-stop guideline for cardiovascular health in Canada. Medications to follow to treat cardiovascular diseases are ineffective as clinicians are rightly concerned that there are too many guidelines with too many individual recommendations to be practical and useful for daily use, particularly in primary care. Typical patients with multiple illnesses require the access to many guidelines at the same time, and some recommendations are not harmonized and often seem contradictory. A new one-stop guideline takes a 360-degree approach to managing heart diseases in Canadian patients with 83 recommendations in one easy-to-use reference. The guideline is published in Canadian Medical Association Journal. Clinical trial finds novel therapy markedly reduced lipoprotein A levels in people with cardiovascular disease. Lipoprotein A is a special type of bad cholesterol that is believed to contribute to heart disease, but there are no approved pharmacological therapies to decrease its concentration in the bloodstream. Olpasiran is an investigational drug that reduces lipoprotein A concentrations by degrading the RNA that codes for a protein that is an essential part of the molecule. Researchers at Brigham and Women's Hospital conducted a phase 2 randomized placebo-controlled clinical trial of olpasiran in patients with established cardiovascular disease to evaluate its safety and tolerability and to identify an optimal dose of olpasiran for reducing lipoprotein A levels. Vivalirudin found to be safer and more effective than heparin for treating heart attack patients undergoing percutaneous coronary intervention. The most common anticoagulant used during primary percutaneous coronary intervention is heparin. However, its effects can be somewhat unpredictable, leading to higher than desirable rates of bleeding and blood clots. Vivalirudin is a newer anticoagulant that has more than predictable blood thinning effects. Vivalirudin is a safer and more effective anticoagulant than heparin for treating patients with the most serious type of heart attacks who undergo urgent percutaneous coronary intervention and can lower the risk of death or major bleeding by 31%, finds a study. The study was a late-breaking clinical trial presentation at the American Heart Association's Scientific Sessions AHA 22 in Chicago and published in The Lancet. Lucid dying. Patients recall death experiences during CPR. 1 in 5 people who survive cardiopulmonary resuscitation after cardiac arrest may describe lucid experiences of death that occurred while they were seemingly unconscious on the brink of death, a new study shows. This study was presented during the Resuscitation Science Symposium at American Heart Association's Scientific Sessions 2022 on Sunday, November 6th. Survivors reported having unique lucid experiences, including a perception of separation from the body, observing events without pain or distress, and a meaningful evaluation of life, including their actions, intentions, and thoughts towards others. Researchers found these experiences of death to be different from hallucinations, delusions, illusions, dreams, or CPR-induced consciousness. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.